Ciao mondo, hello world, hola mundo, hello mom, konnichiwa, ni hao, namaste. We're here in Vicenza at the International Course on Critical Care Nephrology, AKI, CRRT, and ECHOS. And as usual, we may say now, we have guests and partners from the scientific point of view from the Cincinnati Children Hospital. In particular, Professor Stu Goldstein was nice enough to propose for the second consecutive year to generate a Hector Wong Memorial Lecture. And this year we had the pleasure to have Natalia Stanski presenting this lecture. And I would like just her to comment on the title and the content of your lecture.
Sure, thank you. First of all, thank you, Dr. Ronco, so much for having me and allowing me to share my perspective as a pediatric intensivist taking care of kids with AKI and sepsis, which was something that Hector was a great proponent of and an expert in how that perspective may be different, which was really the goal for my talk today, was to share that, particularly coming from someone who benefited from his mentorship for a few years prior to his untimely passing. And so the title of my talk was Age is More Than Just a Number, the argument for a precision medicine approach to sepsis-associated AKI. And I really wanted to highlight, particularly for our adult colleagues in the room, that while pediatric patients are often just an afterthought when it comes to the management of AKI, and sepsis in particular, it's really important to consider the developmental age of a patient because that really impacts the inflammatory response to sepsis, which we now have consensus on as being a key driver of sepsis-associated AKI. And so I hope I was successful in doing that.
No, the lecture was fantastic too. So basically, the pediatric patient is not a small adult, right? There is a complete different approach that should be taken, but the adult nephrologist and intensivist should understand this in order to integrate the approaches.
Yeah, I think what Natalia really showed was not that children should just be part of adult studies, but also should be studied independently. And even in the pediatric age group, there's different developmental associated biological variables that can impact acute kidney injury. And again, we've worked together for so many years, learning from you learning from us, about how we can inform what's going on with the human in front of us. And we have to take care to really understand what are the similarities and what are the differences in the patients that we treat. And your conference is so great in the cross-fertilization for us to learn from each other. And I think Natalia showed that, not to the exclusion of adults, but in addition to adults as part of the whole life course.
If I have to summarize this, which can be virtually defined as personalization, as phenotype treatment, etc., I would like to use a sentence that my father, family doctor from the mountains, always told me, and it is, Claudio, we're not going to treat a disease, we are going to treat a sick patient. So we are treating an individual. That's why we have to be extremely careful in analyzing the characteristic of the individual you have in front of you before you apply any type of intervention and therapy. Well, thank you very much for presenting the Hector Wong Memorial Lecture at the Vicenza Course. Thank you very much to the Cincinnati Children Hospital and Stu Goldstein for being such a wonderful scientific partner. And well, let's see next year what the future will have for us in this area. Thank you very much. Excellent.
Excellent.